South Alabama. Today I'll be performing a tracheostomy care skill. I'll be performing skills 11 through 14. I would first like to acknowledge that I have on clean gloves and now perform my aseptic technique by opening my tracheostomy care kit away from me. I will then pull out my sterile drape. Being careful to only touch the shiny side so that I will not break sterility, and I will lay it on a flat surface. The next thing that I will do is I will empty out my contents from within my care kit onto my sterile drape, staying within the 1-inch border. I will then cross over and avoid touching my 1-inch border, grabbing one of my saline compartments. The next thing that I will do is I will grab my saline and I will check the expiration date. It says 12/5/2020, which means that it is still good for use. I will now palm my saline, holding my cap upwards, and I will pour, avoiding any splashing. I will then recap my saline. After recapping my saline, I will then remove my patient's oxygen therapy, and I will remove my patient's intracannula, placing it into my first saline compartment. The next thing I will do is I will secure my patient's faceplate. It is secured, and I will take my patient's soiled gauze and I will place their oxygen therapy, now removing my clean gloves, glove to glove, and skin to skin. I will now dispose of my gloves. Next thing that I will do is perform hand hygiene, keeping my eyes on my sterile field, not turning my back away. I will don my sterile gloves. Being sure to only touch the border, 1-inch border. Now I will adjust my gloves in a sterile technique, only touching glove to glove, adjusting my fingers. Keeping my eyes on my sterile field and not turning my back away. The next thing I will do now is I will organize my items on my sterile field, keeping away from the 1-inch border. Okay. The next thing that I'm going to do is I'm going to clean out my intracannula from the inside out, grabbing my sterile brush and not touching my 1-inch border. I will clean the inside of my intracannula. The next thing I will do now is clean the outside of my intracannula. And I will dispose of my brush. Next thing I will do is I will rinse my intracannula by putting it into my second saline compartment. I will then come over to my sterile field and grab my pipe cleaners to dry the inside, staying away from the 1-inch border. I have 2 pipe cleaners, And I will grab my intracannula, drying the inside of my intracannula with my pipe cleaners. I will now dispose of my pipe cleaners. The next thing that I'll do is I will grab a 4x4 gauze, staying away from my 1-inch border, and I will dry the outside of my intracannula. Now disposing of this gauze, the next thing I will do is I will come back to my patient. I will remove my patient's oxygen source, and I will hold my intracannula at a 3 or a 9 o'clock angle, and I will insert my intracannula at a 6 o'clock, securing the locking mechanism, and I will also stabilize my patient's faceplate to their level of comfort. The next thing that I will do is I will come back over to my sterile field, and I will grab one of my cotton swabs, staying away from the 1-inch border, and I will then dip it into my 3rd compartment saline, and I will clean from my stoma site outward 2 to 4 inches in all directions in a circular motion. I will then dispose of this, and I will repeat this step, staying away from my 1-inch border, dipping into my 3rd compartment. I will clean in all directions 2 to 4 inches from the stoma site outward. I will then dispose. The next thing that I'll do is I will clean my patient's faceplate, staying away from my 1-inch border. I will dip my gauze in my saline compartment. Avoiding spill. And I will clean my patient's faceplate. Now disposing. The next thing I will do is I will reach over, not touching my 1-inch border, and I will pat dry my patient's skin. Underneath the faceplate, and I will dispose. As I was cleaning my patient's area as well as drying, I was observing around my patient's tracheostoma, under my patient's tracheotomy faceplate, and under my patient's tracheal ties. I was observing for any skin breakdown in relation to blistering, erythema, discoloration, and drainage. Here I will be concluding my video. I have performed the tracheostomy care skills 11 through 14. Thank you.